Whatever.
Hello everyone, my name is Matthew Benjamin. This is NG2 Video Insertion. We got Isaiah Lee on the camera and we're ready to roll. Hello, how are you? My name is Matthew Benjamin. I'm a nurse. The doctor put it in order. I verified the order that you need an NG2. It's going to go into your nose and into your stomach because we need to drain some of the fluid that's in your stomach. Can you please confirm your name and date of birth? Thank you very much. Hand hygiene, the patient privacy, that's great. And now I'm going to explain the procedure to you. It's just a tube that goes into your nose and all the way down to your stomach, and it's going to attach to the suction so we can help you out in the hospital. I'm going to put some gloves on, raise you up to a high Fowler's position. 45 degrees. Oh, beautiful. That's just great. Okay, I'm gonna put this blanket over you so you don't get anything on you, just in case. Okay, that's great. I'm going to measure the NG2. I'm going to measure the NG2 from the nose to the ear to the xiphoid process in between the umbilicus until I meet my mark, and then I'm going to tape it at 49 inches or centimeters, whatever this unit is. Okay, next I'm gonna, since I measured it and marked it, I'm gonna get my lube the catheter 2 to 4 inches, and then I'm gonna instruct the patient, okay, when I put the tube in, you're going to look up at the ceiling, and then once I get down into your throat, you're gonna look down, put your head to your chest, and then I'm gonna give you sips of water to swallow, so it goes into the right tube. Okay. Here we go. Look up at the sky. 1, 2, 3. Okay, that's fantastic. Now I'm gonna look down at your chest. I'm gonna look in the mouth to see if he's coughing or gagging, if there's any coiling. If he's coughing or gagging, I'm gonna stop, look in his mouth, see, okay, there's nothing, and then I may pull back if he is coughing, and then reinsert it all the way until I meet my mark. Okay, that's fantastic. I met my mark. Pretend I met my mark. Okay, it's fantastic. Now I'm going to secure it to the patient and then check per hospital policy to see if it is in the patient's stomach via x-ray or aspirate. I'm going to measure to see how far this is down into the stomach so we can measure and get a good gauge of how far it actually is in the stomach. And then I'm going to attach it to suction, low intermittent suctioning, or per whatever the order is. Lower the bed all the way. Make sure the wheels are locked. Give the patient's call light. Remove my gloves and perform hand hygiene, and then I'm going to document which nair it was in, how long the catheter was in there for. I said 49 centimeters. If the patient tolerated it, I'm going to check the output, the patient, the date, the patient's name, who inserted it. And maybe I'm forgetting something else, Professor, but that's NG tube insertion. We got the call light. We're going to perform hand hygiene after, and Now we're ready for removal. I got the order from the doctor that we need to remove the NG tube because your cancer's gone and you don't have any extra secretions going out. So, okay, I need more gloves. 6 right here, camera, Isaiah. I'm gonna get my gloves going. I'm gonna get another, pretend this is another one of these. I'm gonna put it on the patient, introduce myself. Hello, my name is Matthew. We have an order to take out the NG tube today. Can you please tell me your full name and date of birth? Thank you, Mrs. Smith. Perform hand hygiene, did all that. Okay, now I need a syringe. I need a syringe because I'm going to put 30 to 50 mLs of air, and then I'm going to inject the air. I'm going to turn off the suctioning first. Turn off the suction. Disconnect. Tell the patient to hold your breath. Inject the 30 to 50 mLs of air, and then slowly pull out the NG tube. And then I'm going to look and assess the patient's NG tube to see if it's intact, if there's any deformities on it or anything like that. And then I'm going to document the patient's removal of the NG tube, where it was at the end of the length, which nair I got it out of, who I did it to, the date, the time, and I'm going to document the output of how much the patient was getting out. That's very important because we don't want the patient just still having all these secretions. I'm going to throw all this away, do hand hygiene. I'm going to lower the bed and lock the wheels and give the patient the call light, and that's a wrap.